Yeah, welcome back. So, we learnt about RBC indices. Now we'll go with the important topic, very important topic in hematology, hemolytic hemolytic anemia. So, there are various classifications for hemolytic anemia. We will look into individual classification, how they are classified, and we will learn a good amount of points which will support your knowledge and make sure you'll get good score also with the proper notes. Okay, students were asking, is it sufficient for the board exams? Nothing is sufficient. When if you prepare well with the proper notes, I think that will fetch you a good marks. Okay, so with that we'll continue with the class. Hemolytic anemia. So based on site of hemolysis, we split it into two types: intravascular, one more is extravascular. Okay, we have two types: intravascular, extravascular. So we will look into first intravascular. Just imagine, or not imagine, okay, this is RBC. What happens if RBC break down? So it breakdowns into heme, which is a iron part, then we have globin, right? We have heme, then globin. Heme part which may go into, we have methemoglobin or haptoglobin. And very important point you need to remember is where this globin will go, this will be reutilized. Okay, don't forget. So we have methemoglobin, haptoglobin. Okay, then what happens? So first it's breakdown, where you can see two products, methemoglobin or haptoglobin. Then we will continue. So third one, you will see it will be excreted in the urine. So what you will say? Hemoglobinuria. Very important. And if something is excreting, before excreting it undergoes a very important thing, that is reabsorption. How kidney will live? Like you can go without any hurdles? No, kidney won't allow it. So PCT reabsorbs, which leads to hemocytry. Nothing is easy to fetch, okay? Even kidney is following that policy. Hemocitrin, which leads to hemocitrinuria. I hope there is no doubt. So what happens? First, RBC will be breakdown into heme and globin, which forms methemoglobin or haptoglobin. Okay, then RBC, it forms hemoglobinuria, where PCT reabsorbs. Further hemocitrin is formed, then hemocitrinuria. So this is about intravascular thing. Now we will see about extravascular. Remember, extravascular is nothing but except the vessel, whatever happens is extravascular. So it was a lame joke, still you have to remember it. Okay, so there is only one thing extravascular can happen, that is your spleen. Okay, spleen bhaiya is very horrible. He says nahi chodenge. Spleen, where engulfment happens by splenic macrophages. Okay, pause the video. Chocolate question: what you'll call for splenic macrophage? Should answer that in my comment section. Okay, it is called as, use the comment section. At the end of the video we will see what is the name of the splenic macrophage. Okay, if something is eating, if you are eating ice cream, at one point when you see the mirror or someone says अरे तुम तो मोटे हो गए भाई, तो even it happens with the spleen. At one point spleen says अरे भाई मैं तो बहुत मोटा हो चुका हूँ. Okay, splenomegaly. So based on site of hemolysis we have intravascular, extravascular. Intravascular, hemoglobinemia, heme, globin, methemoglobin, haptoglobin. So RBC, hemoglobinuria, PCT reabsorbs, hemosiderin, where globin is, adjust with this globulin and globin. Okay, it's a globin, okay, no confusion. Extravascular, we have spleen, which engulfed by splenic macrophages, splenomegaly. Okay, let's see who answered first. Okay, so what you call for splenic macrophage? We say littoral cell. Okay, tell me who all wrote it correct in the comment section. It's a littoral cell, don't forget. Very important physiology question. There are various names for macrophages present in the various sites. So here we are learning about splenic macrophages, which is called as littoral cell. I hope this is clear. Hemolytic anemia based on the site. So in further videos we'll see another classification, very important, don't forget it. You'll fetch very good marks if you study well pathology, which also supports you for the medicine basics. So study well, revise well. Hope you guys enjoyed the video. Thank you.